Member for Moore.
Thank you, Acting Speaker. My grievance today is to the Minister for Health and concerns the Turquoise Coast Health Initiative. This was a $22.46 million investment approved by the previous government and was focused on the growing peri-urban and coastal areas of Chittering, Jurien Bay, Lancelin and Dongara to deliver essential emergency, acute and palliative care, short-stay and community-based care, rehabilitation, community midwifery, physiotherapy, social work, aged care and seniors' mental health care, along with an expansion of telehealth services, including at community resource centres, to help streamline primary and outpatient care, all augmented by a new quick retrieval helicopter landing site at Jurien Bay to support more responsive emergency care. The funding also included financial incentives for local GPs and extra aged care beds in the Dongara Health Service. In regard to the history of the development of this plan, on the 23rd of April back in 2014, I wrote to the then Minister for Health, Dr Kim Hames, and outlined to him that ever since my election in 2013, I'd learnt from my constituents that health services provision to them is problematic. Often there's a confusing landscape of many different layers of service provider, and many of my constituents complained of a lack of services, especially in areas such as the Gingin, Dandaragan and Mid-West Coast and the high-growth Chittering Shire. Southern Inland Health Initiative had invested $565 million in infrastructure and services, but for the most part that largely ignored this growth in this part of the Midwestern Wheatbelt. I noted the Wheatbelt Planning and Infrastructure Framework, which in regard to SciHi stated the $565.34 million funded under all these regions. While SciHi will offer improved services to a large part of the Wheatbelt, projected growth in the shires of Chittering, Gingin and Dandaragan is expected to create demands for health infrastructure which is not within current SciHi funding. Servicing of these areas must be considered through sub-regional planning. Minister, a number of discussions then took place with WACS and Dr Hames, and I again wrote to him on the 22nd of October 2015, thanking him for taking the time to meet with myself and the Honourable Martin Aldridge, along with WACS officials Mr Jeff Moffat and Ms Melissa Vernon on that same day. I went on to say that I had for some time been concerned at the lack of appropriate health services in the growing shires of my electorate, such as Dandaragan, Gingin and Chittering, and previously written to him and met with him and WACS regarding my views. I was also of the view that the coastal population in the Shire of Carew and the town of Lehman and Greenhead should be integrated into health delivery with the town of Jurien Bay. This is currently hampered by the arbitrary line that exists between the Wheatbelt and Midwest Health Districts. In the course of the October 2015 meeting, Mr Moffat confirmed that WACS were indeed already building a health plan for this district, concentrating mainly on services. That plan was not yet funded. I was pleased that Dr Hames appreciated our concerns and indicated to Mr Moffat that he, Dr Hames, would like to see a program for the district starting at Lehman, heading south of the metropolitan boundary. He indicated the program could be akin to programs such as SciHi, but that it would not have to fit into the normal Wheatbelt model, and that suitable health and aged care in this district should indeed be a viable option. I then asked that WACS work to develop a business case to improve health and aged care for my constituents in the above-mentioned shires. Subsequent to these developments, and contrary to the claims made by the Minister in budget estimates that this initiative lacked a sound business case, a business case was developed. And finally, in January 2017, the Cabinet approved $22.46 million investment in the Turquoise Coast District Health Service. That Turquoise Coast District Health Service was included in the 2016-17 pre-election financial projection statement under the heading Minister for Health, Culture and the Arts, with $4 million towards services in 2017-18, 4.7 in 18-19 and 4.8 in 19-20, and not mentioned in that statement, but certainly part of the Cabinet decision was further funding in 2021. With asset investment of $0.7 million in 2017-18, this current year, and $500,000 in each of the two subsequent years. However, Minister, your government subsequently made the decision to cut more than $21 million of Royalties Region's Cabinet-approved funding for the health initiative in what was very sad news for those living in the affected communities. Instead, Labor has committed to just $1 million to fund 4 to 6 aged care residential beds in Dongara. Since the loss of the funding, one of the most severely disadvantaged shires, the Shire of Chittering, has been approached by concerned community members about the level of service delivery to residents within the Shire. These residents in the Shire are seeking better health service options. Of particular concern has been post-operative nursing and support services and palliative care support to residents. Especially regarding post-operative or post-hospitalisation services, there seems to be a lack of awareness of service provision options available to residents of the Shire of Chittering. The Shire does not easily fit within the definition of rural or urban, a problem compounded in some cases by the sharing of postcodes between regional Chittering Shire residents and metropolitan City of Swan residents, leading to some ambiguity of service provision. Compounding of health care issues is a lack of access to the Patients Assistance Travel Scheme for many local residents, despite the fact that the Shire has an ageing population and no public transport options to assist residents to access specialist services in the metropolitan area. The Shire has established a health service roundtable to give an opportunity to share information on current service provisions. It's also hoped to, through discussion, to further identify gaps in service provision and seek collaborative solutions to these issues. This proactive step by the local community in the face of the indifference of the government is of itself evidence of the serious nature of current health service shortfalls in the Turquoise Coast Health Initiative area. Minister, I heartily reject the claim made in budget estimates that this program lacked a sound business case. I ask the Minister to table or provide me any needs analysis work done by WACS in the Turquoise Coast Health Initiative catchment and any supporting evidence for the business case that was developed. I ask that you outline your plans to address the demonstrated health needs of this area, and I believe that you can achieve that by recommitting funding to the Turquoise Coast Health Initiative. But if that's not possible, then I would request the reallocation of Health Department resources from other areas so that people in my electorate are given an equivalence of service to what other regional residents have been provided. Thank you, Minister.
Minister.
Thank you, Acting Speaker. And I thank the member for bringing this issue to the attention of the House. It's an important issue, how we provide services to people in rural and regional communities in relation to health is something which we need to plan very carefully for and make sure that our health dollar goes to maximum effect to ensure that people in rural and regional communities do get the services that they deserve. Unfortunately, Acting Speaker, that's not the way that I think royalties for regions was treated in relation to a lot of the health spending. Indeed, I think part of the problem is, as the members pointed out, that a lot of the money went to those politically sexy areas and perhaps not the areas of greater need in relation to some of the funding around health. And for that reason, I commend the member for highlighting these issues of disparity in relation to bringing this matter to the place. And it's true that the previous government did commit to a range of spending initiatives around the area referred to as the Turquoise Coast. One of those, Acting Speaker, was on the 1st of February, a $7 million to access to aged and dementia care, grants across the Great Southern Goldfields, Wheatbelt, Midwest, funded through the Southern Inland Health Initiatives and royalties for regions. And I think this is part of the problem, Acting Speaker, that this was done 1 day before the actual writs were issued. So let us understand what this is. This is the tail end of what is essentially some election commitments. And I respect and understand that governments make election commitments in the lead up to elections, but so do oppositions. And as such, we have a range of commitments and priorities that we want to see brought to fruition in the context of royalties for regions, and we can't just continuing to spend. I think that the Premier summed it up best when he based in the article in the West Australian recently, where he suggested that they spent too much. He says, as time went on, the projects that became more marginal, I think that's where it was overly indulgent. That was the problem with the alliance with the Nats. Now, I've never been in an alliance with the Nationals, so I cannot provide any insights into that, Mr. Speaker, Acting Speaker, but I would say that what we had under the Royalties for Regions programs is a shopping list of things that people would like, not necessarily a properly analysed list of what is needed. And it's probably, and I think there can be no better demonstration of that, is once the Nationals had wrecked the state's finances, they then went on to find new fields of funding to continue on essentially the way they've been going all along, which is to simply continue to spend without actually understanding that governments cannot spend in perpetuity. There has to be some restraint, there has to be some prioritisation. So I respect the member for bringing this to the place, bringing these issues to this place. But one of the things that we have to do is actually operate within our means. And so upon coming to government, we obviously had some priorities. Those were to commit to our election promises in relation to the Royalties for Regions program, but also to just make sure that we got the finances back under control. And that is try to, over the forward estimates, reduce the deficit so we can get back into surplus, and over a longer period of time, reduce state debt. And so we had to make some difficult decisions, Acting Speaker, and unfortunately some of these projects were ones which we identified had to be set aside for the moment until we have a better line of sight in terms of the actual needs in relation to it. And I take the member at his words. I don't for a moment say that these services aren't needed. I'm simply saying at this point in time we can't afford them. I do make a commitment, Acting Speaker, as I did at budget, that all these Royalties for Regions health projects aren't forgotten. They will be borne in mind, and we will continue to look at them and to see how we can fund them into future budgets. And I commit to working with the member to make sure that we can get a proper analysis on where the priorities are, and make sure that we can fund them in due course. As the member has observed, there are services which will continue at Geraldton, Dongra, Lancelin and the surrounding towns. And as the member, I think you observed, although I'll remind you, we've maintained our the funds for the redevelopment, $1 million worth of funds for the redevelopment of 4 to 6 extra aged care beds in Dongra. Now, there has already been some work which has been undertaken in relation to the Turquoise Coast, which means that patients do have some improved urgent and primary care facilities, as well as aged care facilities. And also, Acting Speaker, the residents in this area will continue to enjoy the improvements or the rollout of emergency telehealth, other telehealth services and so on in relation to into the services available in that area. I note the member said that, that people of this area struggle to access PATS. So I'm very keen to work with the member to actually understand the nature of that problem and get to the bottom of it to see how we can continue to improve PATS to make sure that it serves the needs of people in those communities. So I confirm to the member that these projects unfortunately had to be reprioritised. They are not forgotten. We will revisit them, and I will personally visit these facilities early in the new year to make sure I get a personal understanding on these things. Can I just make the final observation, Acting Speaker, that budget repair requires not only identifying cuts but also identifying opportunities for revenue growth. And the best way that we can be in a position to fund these sort of projects is for the member's party to actually support our revenue measures, including the very understandable increase in gold royalties. And as a result of that, Acting Speaker, I think we can all reflect that the best way we can get these services to these people is budget repair, and the member's party should be on board to assist us with that.